Hello and welcome to this special webinar on 1000 Days of the Pandemic. I'm your host, Ramananda Sengupta, and we have a really illustrious list of panelists lined up today. But before I introduce them, a quick word about why we are running this program and what we hope to achieve. Outlook has launched this campaign to understand the implications of this pandemic on the government's 1000-day program. We would also like to examine ways and means to ensure that it is brought back on track, perhaps in a more effective manner, while adhering to the restrictions imposed on us like social distancing. In the process, we also hope to bring about awareness about this program among people who may not understand why this program is so critical, not just for expectant mothers and their children, not just for the nation, but the entire world. With that, let me start introducing our panelists today. We have Dr. Francesco Branca, Head of Nutrition, who has logged WHO, who has logged in all the way from Geneva. Thank you, sir, for that. Dr. Shweta Khandelwal, Professor at the Public Health Foundation of India. Mr. Chanchalapathi Dasa, Vice Chairman of Akshaya Patra. Dr. Sujeet Ranjan, Executive Director of the Coalition for Food and Nutrition Security. And of course, Dr. Arjan, Head Nutrition, UNICEF India. Let me start off with Dr. Branca. Dr. Branca, if you could give us a sort of a global perspective on, how this 1000 days program has been impacted by the pandemic, particularly in developing nations, and what steps has WHO taken to sort of, alleviate the challenges that this pandemic has brought up?
First, let me thank Outlook Poshan for the opportunity to discuss these issues. We all know that early nutrition is so critical for child health, for child growth and development, but also for long-term health, the prevention of non-communicable diseases, and the long-term performance on physical, mental health, educational attainment, job success, salaries. So that's so critical. And the world is still affected by a large number of children who are malnourished. We have 144 million children with stunting and 47 million children with wasting. And these are our latest estimates. So we're doing a bit better, but what is happening is now that the pandemic is probably going to push us back. I must say that I'd like really to praise the government of India for having made the fight to malnutrition a priority. And this requires really action in multiple sectors, certainly health, social support, and food system. Now, COVID-19 has had an impact in all those systems. We have seen an increase in food insecurity with closure of markets, decline in agricultural production, disruption of household economic job losses, and an impact on dietary adequacy. And we have seen a major impact on health system. Now, WHO has just completed an assessment in 70 countries, and just looking at the services that are really for having an impact on child nutrition, we have in 45% of the countries a partial disruption of the services to manage malnutrition, 5% with complete disruption. Immunization services, 54% partially disrupted, 17% completely disrupted. Antenatal care, 59% partial disruption. Even facility-based births have been disrupted in a third of the countries. And I must say that we were concerned to see that India has reported a large degree of disruption. And this is due to the fact that people don't go to the services. I mean, they are restricted by the breakdown of transport, they cancel appointments, and preventive services have suffered a lot. So health systems have perhaps in this last few months failed to address the needs of these particular groups. And this actually adds up to a deterioration of care practices. I mean, in some countries, there's been even the recommendation to separate mothers or caregivers from children due to quarantine. And that has led to a problem to breastfeeding. But we anticipate now that this is going to have an impact on nutrition. We anticipate that probably something in the order of 10 to 20% more children which will show malnutrition, and that's really a striking figure. So WHO is working really to maintain essential health services. We have been in the context of the COVID response. We've been supporting countries, first of all, with equipment supplies, with supporting the capacities of the staff, mainly for the COVID response, but now also to highlight the need to maintain essential services. There's been several guidance documents produced there, and WHO has worked with governments and partners to provide support to health services. I must say that 60% of the countries have made a plan. So there's been a partial success in making sure that these health services wouldn't be disrupted, and also having a way forward to correct it. And finally, particularly on nutrition, WHO is working with sister agencies, particularly UNICEF, World Food Programme, and FAO, to launch a call to action to address the impending increase in malnutrition. Thank you.
I think we really love to get involved with that program if we can. I think if Arjan and you could tell us how we can help, we'd be more than happy to sort of help you in any which way we can. But I'll come to you, Dr. Khandelwal. Could you tell us a bit about what happens when this program actually gets disrupted, and the sort of economic and social implications of it, both in the short and long term? Why are we so concerned about it?
Sure. So as we have been discussing, and Dr. Branca also referred to it, the first 1,000 days are a very critical window of opportunity. They're a window of vulnerability as well as opportunity, because that those 1,000 days make up your entire future's adult life's health and well-being is determined by those first 1,000 days. So it's very, very important that improvements in nutrition during this period, which are going to have the greatest impact in population with poor nutrition, for example, come into play because of these first 1,000 days. And it's not now that we are discovering the importance of nutrition overall in health and well-being. Adam Smith, for example, in 1776, 250 years ago, he believed, and he said, he propagated that the wealth of nation depends in part on health and on nutrition skills as well as knowledge of their people. And poor health and nutrition as well as lack of education, lowers economic productivity as well. So you see all these concepts of productivity, of health, and of nutrition are very, very much interrelated. In terms of the impact which you're asking me to talk about, I have summarized it as huge, HUGE. One is on human capital. H is for human capital, and I will discuss each of these four in just a little bit. The second is the undernourishment overall. So H is the human capital, U is the undernourishment, G is for growth and development. The implications on growth and development cannot be missed. And fourth is the E, which is the economic implications. So when I talk about this huge burden of issues which India is going to face, it's really a lot of factors interplaying and panning out in front of you. Now, when I said human capital, it has got a very, very direct relationship with the first 1,000 days, because not only the brain development occurs at a maximum speed during that time and leaves an impression for overall life, the productivity gets impacted. There's a short stature being stunted, which is also linked with economic implications later on. There are delivery complications which happen because of poor nutrition during these first 1,000 days. There is rising overweight, obesity these days, which has a link with gestational diabetes. We know that if children are born small, they are low birth weight, or they are born small, they are bound to have a lot of high chances to get diabetes in later future, cardiovascular risks in later future. So, also poor IYCF. Immediately after, because 1,000 days is also 2 years of the child's existence in the world. And that time, what are we feeding the child? How are the infant, young child feeding practices panning out? And in that context, the COVID, which is right now disrupting everything, will make a huge impact. There's also a lot of micronutrient deficiencies which we will see in the kids to come. Not only because India already has a huge burden of micronutrient deficiencies, but also because now the nutritious foods per se, the supply chain of those nutritious foods have been hampered and they're disrupted. And so as it is, the poor, or even in general ways, people switch to cheapest caloric intake, not on the nutrient dense foods always. And right now, these nutrient dense foods are as it is, impacted, and therefore all these implications on micronutrient deficiencies also are going to come to play. So that was the H, which is human capital. Then the undernourishment overall, we already know we have 38% stunted, 21% wasted in India. The kid numbers are, and every day 70,000 kids are being born in India. Imagine the implications you are having on lives, and this is the birth. 70,000 are being born. So of course, the pregnancy time, the children who are in their first 2 years of life, this is a huge number we are talking about. So there is a profound impact of COVID on all these services as we go along. Growth and development, as I already discussed, it will have not only implications for productivity of these children, but also health for later life. And economic implications, not only the food prices are going to go spiraling up, which is making it difficult for people, even us so-called who have access and information, very difficult for us to consume the 5 fruits and vegetables every day. Imagine the people who are just very, very far from this dream, so as to say. In addition, we also know that there is also an equal, in fact, a very, very high returns of investment. So if I invest $1 in nutrition programs, I get $18 worth of benefits in the general global picture. But for India particularly, this has been worked out to be in fact twice as high, about $36. So even more a case to sort of act now. I'll stop here, and then probably we'll take questions more, because I can go on.
Khandelwal, for putting such a huge problem into perspective. I mean, it really helps us understand this whole thing. Dr. Deva, UNICEF has done some really fantastic work in the field of nutrition, not just in India, but across the world. But could you tell us something about challenges that you faced while sort of performing your way of reaching out to, teaching nutrition to the right people, particularly during the times of the lockdown? And more importantly, I'm not talking about just UNICEF per se, but maybe your partners or maybe even the government. Maybe you found some innovative ways in which this was being addressed. If you can think of some, maybe you could just tell us.
Yeah. Thank you very much. And first of all, congratulations again to Outlook Portion about taking nutrition on, as you have been doing for the last year. And I always say that having the media and publishers be part of the fight against malnutrition is an essential component. I've been in India now for more than 3 years. I've never seen a government response like in India on nutrition, so successful and so committed. It was slightly over 2 years ago. It was 8th of March 2018 when the Prime Minister launched Portion Abhiyan. And when it was launched, I was wondering, hey, is this another promise, another document, another strategy? But actually what we have seen in the last 2 years is with very high level leadership from the Prime Minister all the way to chief ministers, to other ministers, all the way up to district and community level, a lot of action and awareness on the importance of nutrition. And I've never seen it in my career working on nutrition now for 25 years, that kind of leadership and resulting in action on the ground. If you look at, for instance, Portion month in September last year or early March, if you see the number of people mobilized to get awareness around nutrition has been amazing. There are also significant financial investment promised by the government. And it's important to recognize because about half of the children have underweight, they're too thin, or have wasting, they're too thin, or they're too short. About half of the children under 5 have one form of malnutrition already, as mentioned. But again, I want to start with the government response of Portion Abhiyan, because that has been amazing. And I know that many of us working in India as partners from the academia, civil society, but definitely also the UN, we have been amazed about this, and we've all put our weight behind this government program. It's an amazing program. It's an amazing promise to the children of India. And we started seeing the initial results. We started seeing that malnutrition rates seem to be going down based on some preliminary state data, started going down slightly faster in the last few years compared to the 10 years from 2006 to 2016. So there was an acceleration in reduction of malnutrition. and then COVID came. Yeah, and as the colleagues have said, things have really fallen down. What I'm also worried about is that what is going to happen with Posh and Abidjan? The intensity of the guidance and the leadership in Posh and Abidjan, all the way from the Prime Minister, but that has been going down all the way to everyone, up to community level. Can we get it back again? Maybe not today, maybe not tomorrow, but very, very soon again, because I know that everybody's busy with COVID, but that leadership that made a difference. A lot of the services have stopped. And as we as UNICEF, we've been working hard with government to see how can you restart services again. And there's some good examples. Rajasthan, Maharashtra, examples where Anganwadi workers, some of the frontline workers started using within the WhatsApp groups to share information because they didn't bring people together anymore. And the group meetings were stopped. And for instance, then in Rajasthan, they've been scaling that up to get nutrition messages out to more than 20,000 WhatsApp groups. In Maharashtra, the government saw the success of the WhatsApp groups and started institutionalizing it and really supporting Anganwadi workers to use that. We saw that at the beginning of the COVID crisis that nutrition rehabilitation centers were being closed. Yeah, and that are centers in hospitals where the most severe cases of malnourished children are being treated. They were being closed because the health workers were needed or the space was needed. But in the last months, we started seeing that in several states, they're trying to reopen it again. Yeah, and actually I have some preliminary data from some places. We see when it comes to access to services, we start seeing a U-shape, where in March, all the services were basically being stopped. And March, April, not much is happening, but we see towards the end of April and May, slowly we see services starting a little bit again. And many cases in an adjusted way. It is, I call this COVID-sensitive nutrition programming. COVID-sensitive delivering of nutrition programs. A very successful program that the government has, and many of the partners are supporting that, are village health, sanitation and nutrition days, where one day in a month, immunization is given, awareness of nutrition is given, weighing is done of children, and that are mass campaign kind of approaches. And we see that several states, if instead of doing it in one day, they might spread it over more days and reduce the number of people, and also give protective measures to the Anganwadi workers and the Akshaya workers, so that indeed they are protected. They're using the mouth caps, the face masks, they're using sterilization methods. So we see a lot of these kind of efforts. 2 weeks ago, the Ministry of Health released guidance for further, I don't call it normalization, but the guidance to the states to restart many of the services again. But also the Ministry of Health recognizes that, yes, we have to prevent death to COVID, but not at the expense of death due to other childhood illnesses and any common illnesses, or also from malnutrition. And I know that UNICEF and WHO and the NGO communities and all of us, we are supporting state level governments and district level governments to try to translate this guidance by the Ministry of Health and by the Ministry of WCD to reorient frontline workers on how can we continue providing these essential services. But not only that, it's not only about the services, we also have to go to the communities. We hear that many people are afraid of going to the health workers, afraid of going to health facilities. And we also have to help people to be aware, how can you protect yourself about COVID, but also how can you continue seeking services when you are, for instance, when you are pregnant. And as Dr. Branca said, indeed there is data from India that seems to suggest that uptake of ANC services have reduced. Yeah, but we have to make people aware, don't be afraid. Here and there, we have to explain where they can get access to these services again. So that indeed, the access to services and the uptake of services will continue. Thank you.
Oh, okay, great. I think that gives us thing. Mr. Dasa, I would probably ask you the same question I asked Dr. Deva, but but in a different way, Akshaya Patra has one of the world's largest sort of food programs. And, it's a really fantastic job of feeding the hungry, particularly during, the migrants who were trying to return home, and things like that during that time of during the pandemic. But I'd like to hear from you, about the kind of challenges you faced in doing this while you were implementing this. What kind of challenges did you face? What kind of obstacles did you face? And the second part of that question would be that, did you ever come across, a different set of, let's say, a pregnant woman, was she treated differently, or was it just a generic kind of a food program?
Okay. Thanks, everybody. Thanks, Outlook portion, for having Akshaya Patra in this panel. Yes, as you said that we have been doing at the very ground level work in the last 2.5 months during the lockdown in our country. And we have been doing two things. As you know, that Akshaya Patra we have about 52 centralized kitchens in different parts of the country. And about 30 or 33 kitchens are active, and we are cooking meals and serving to different people. And we have also been distributing grocery kits, so that, in this particular situation where contact with people also is a bit of a challenge. And so we give away a grocery kit, essential grocery kit, which will have essential groceries for 21 days, 2 meals a day. That's about 42 meals. So that's another important thing. All put together, we have distributed about 63 million meals in the last 2.5 months, both cooked meals and the kits. And yes, in terms of the challenges, what happened in most of the places in the country when this happened, the summer vacations had already begun and our kitchens were already shut down. During summer, we don't operate summer vacations. And so most of the employees in our kitchens, we have about 7,000 employees, and they all had returned to their hometowns, small villages, and so there were probably in and around the kitchen facility, maybe about 25% of the employees were from the immediate vicinity of the kitchen. So when the governments started asking us to prepare meals and distribute them in different vulnerable sections of the society, the first challenge that we had was that we didn't have people. We didn't have right kind of people, enough people to cook. And it was very difficult to bring them back. They were 150 kilometers to 900 kilometers away in different parts of the countries. So we had a lot of challenge getting people to work. And I remember in places like Lucknow and in places like Mathura in Uttar Pradesh, people had gone away to their homes and we had a very hard time to get them back. And so our HR department and different people in the department would continuously be reaching out to people to call them to come and work. And they would say, no, we cannot, and the parents of these workers sometimes would take the phone and say, you want my son to die? Didn't you hear the Prime Minister is telling, don't step out of the house, and you are telling my son to come and work? These kind of, by and large, we had these kind of challenges. And the governments were very, very supportive. Because of the breakdown of the supply chain and all of that, we would not get raw materials. And then there was one agricultural market in Bangalore, which was shut down, and it was being opened only once a week. And for our requirement, they just specially opened it and made all kinds of provisions. So we have seen that the local governments and at different levels were very responsive. We had a lot of support from them. It was mainly challenge of getting the workforce to cook and to prepare the meals and distribute. So that was the main challenge. And I would also say the positive side. The governments were very responsive, and our donors, we had a large number of donors. They all came forward, individual donors, corporate donors. They all wanted to help, how we can help and reach out to children and people, not just children. So that's the response that we had, I would say.
Thank you so much, Mr. Dasa. Dr. Ranjan, I recall an interview of yours where you spoke of the importance of civil society in sort of ensuring that nutrition reaches the people who need it the most. Would you like to elaborate a bit on that?
Yeah, thank you very much, Mr. Sengupta, and thanks for having me here. And you have raised a very valid question, and as we know it very well that India is not battling COVID-19 outbreaks only. We are also fighting undernutrition in the country. So we are having dual burden on our country, existing undernutrition and undernutrition induced by COVID-19. And here the role of civil society organization, because coalition is a group of policymakers, program leaders, civil society organizations. So the role of civil society organizations, especially today and in coming days, we feel like it's a very great role, very critical role, very important role they have to play. Even with so much of negativity, there is a silver lining for this sector, which will make the country stronger and make its own place much relevant in coming days. The crisis, this COVID-19, the crisis brought us together again, because I'm from this sector for last 25 years, and I have seen this phase when all the civil society organization, NGOs, how we have come together with more focused deliverables and objectives to make India, to make our country a stronger country, and how we should learn managing its human resources. Because personally, like when I was interacting with all our civil society organizations, it was felt that how the capacity of the civil society organization, how we can deliver the best, understand the best, and support, contribute in a very meaningful manner. And COVID-19 is a unique opportunity, to reform our civil society organization and especially the public health nutrition sector. And a strong public health system in our country will benefit everyone. And there is no better time than now to make it happen or make it in reality. Number one, I was based on the discussion I had with all our civil society organizations, those who are member of this coalition, like to boost the public-private partnership, to build the data culture, to engage the communities in a more effective, meaningful manner, and to engage private healthcare services, and to invest, to encourage them, influence them to invest in public health. So if you reform our public health system now, it will create an opportunity for ripple effect in other areas too, like instance of nutrition, water and sanitation, and other social sectors. So like civil society organization, including self-help groups, it can play a very active role in the supporting solution to the local level, such as promotion of nutrition garden to generate self-reliant populations, support capacity building efforts, nutrition security, even the technology, how the technology innovation in agriculture, in data collection, in our counseling, how we are reaching to the mothers, reaching to the family, building the capacity of mothers with regard to the feeding practices. So there is an important role they have to play, and we are ready to do that. Then the role of even the I'm also including Panchayati Raj institution in our country. That's a very, very strong and like Gram Swaraj, which Mahatma Gandhi was always talking about. So the role of Panchayati Raj institution can facilitate the availability, accessibility, and also the counseling for proper utilization of services at community level, at household level. So the role of civil society organization, including self-help group and PRI, will definitely make a great role, and the private sector plays a significant role in the social development, a right time to explore public-private partnership opportunity for creating a sustainable public health ecosystem. Thank you very much.
So much, Dr. Ranjan. Dr. Branca, this pandemic doesn't look like it's going away anytime soon. We're going to, until even if we get a sort of a vaccine, and then by the time it is sort of used and everything, WHO, I assume, has already sort of thought out a plan to sort of work around, or try to ensure that its nutrition goals are not impacted by this thing. Would you like to sort of elaborate on a few steps that you might have taken, and how you plan to sort of address this whole thing, if you have any such plans in mind, both short term and long term?
Yeah, thank you very much. I think it's an important question, and I think this somehow was already referred to by some of my other colleague panelists, particularly Mr. Ranjan, who is referring to COVID-19 as an opportunity. So yes, indeed, there's an element of response that is still has to happen, and unfortunately, we still have an expanding pandemic. We don't know what the perspective is about its end, but certainly we're looking into a few more months until we have vaccines and therapeutics and better diagnostics. WHO is working with many partners on an accelerator to have all these elements as public goods. And there is a major commitment by several partners on this. So we hope to be responding to the pandemic. But at the same time, on food and nutrition, we need to take action in a number of ways. And I really would like to perhaps refer you to the very interesting policy brief that UN Secretary General has issued a couple of weeks ago, and to which basically all contributed, on the impact of COVID-19 on food security and nutrition. And that brief is, has three elements. First, what we need to do is to mobilize to save lives and livelihoods, focusing attention where the risk is most acute, which means we need to declare that food production, marketing, and distribution are essential services everywhere. And we need to ensure the protection of food workers, and also avoid that trade barriers are established between countries. Scares around food which is unsafe, these are inappropriate. So we need to make sure that food is produced, distributed, and accessible to all. We need also, of course, to preserve humanitarian food and nutrition assistance, and what we heard from Venerable Mr. Dasa is important. This is actually happening in many parts of the world. School food is not available because schools are closed, or there's no system to do that. But those systems have to be urgently put in place. The second important area is to strengthen social protection system for nutrition. And I know that this is one of the remit also of the Poshan Abhijan program in India. Food and nutrition assistance really need to be at the heart of social protection programs, in more and more in cash, but of course also in kind. And then we need to strengthen the health system response for nutritional care. The additional over 6 million children which will come with malnutrition in the next months. We need to, first of all, prevent this to happen, but then we also need to be ready with stronger systems. At the moment, we're only able to serve about 1/5 of the world children with acute malnutrition. This number will increase. So we need to also increase the capacity of those services. And the third element is really the investment in a sustainable future. Again, considering the epidemic as an opportunity, laying the foundation for a more inclusive, green, and resilient recovery. WHO has just launched a manifesto for a healthy recovery from COVID-19. Countries are making big investment because of the economic crisis. It's the time to direct those investments to strengthening the right services and making the right investment. For example, promoting healthy and sustainable food systems. For example, strengthening health services. For example, in ensuring an energy transition and so forth, having more livable cities. I think this is really an important message that we need to give. We cannot just go back to the previous situation.
And again, I'd like to offer whatever services or help that we can in helping you promote these things. Anytime that you feel the need to sort of, need a media hand to sort of, help disseminate some of these things, I think it will help reach people. Dr. Khandelwal, I realized that you mentioned it earlier as well, but they say that even if a pregnant woman tests COVID positive, after birth, she's still expected to sort of breastfeed with certain restrictions. Could you sort of tell us why it is that critical that, we earlier heard that there were people being separated, but, at the same time, there are recommendations that, even if the mother tests positive, that she should still try to breastfeed in the first few days at least. Could you explain why that is so critical?
Right. So exclusive breastfeeding, as we all know, is very, very critical for the first 6 months of life, especially. And that is essentially because it's the form of nutrition which the child gets, which is unadulterated, which is natural, which is full of immune boosters, and which is going to sort of set you for life. It's the first food which the child gets from the mother, which is really trying to protect you for or ready you for the later life. So therefore, these percentages which we calculate of how many are exclusively breastfed, becomes very critical. In fact, WHO itself, in their World Health Assembly goals for 2025, indicated that the exclusive breastfeeding rates should be increased by every country. And in that regard, India, for example, is at 54.9% exclusive breastfeeding. But we must go beyond looking at that national composite number, because it ranges when you actually see the diversity among so many of our states. It goes down to as low as 35.8% in Meghalaya to 77.2% in Chhattisgarh. So there's a whole huge variety of issues which are, people may think it's such a natural thing and it's free of cost in that sense. Like, what's the big deal? But there are so many issues involved that we have not been able to advocate this message properly enough, or stress it enough that, forget 100%, even 80% exclusive breastfeeding to reach to that target has been such a challenge. Of course, in the last decade, we've come from 46 to 59 or 55%. So it's a very slow progress which we are making on something which is doable. So I think pushing, if you see Poshan Abhiyan's, the mentor, Dr. Vinod Paul, and others who are from Niti Aayog and others and from the ministry, they all have said that these are things which are fixable, which are modifiable. And so therefore, I think as nutritionists, as public health advocates, we should try and think about how we can promote this better. How can we leave this message? Perhaps the mothers need more support. Perhaps the nutrition counseling needs to be integrated early on, rather than just once after you've delivered. Maybe this is a message which has to go on and linger in the mother's tone, as well as the whole family, who should actually understand the importance of breastfeeding, that this is not only the time for bonding between the mother and the child, but also a very, very important source of nutrition as well as health later on. So these are very, very important factors for me, therefore.
Mm-hmm. So you're saying that it is so important that people are willing to sort of take the risk of even, a COVID infected mothers still wanting to do it? It's that important. That's what I'm hearing.
Yes. See, everybody these days is very, you may have seen all social media everywhere is full of finding ways to enhance your immunity, right? They're equating COVID fighting or COVID tackling to immunity boosting or immunity enhancing. Although it's not the most appropriate way to put it when we talk among scientists like ourselves, but immunity definitely is a very important factor. And therefore, nothing more than breastfeeding will give you the initial immunity, so as to say. We all know that in India, especially, the hygiene practices are very poor. When you make those bottles and feed the children with those bottles, there's a huge amount of costs of human lives which are involved in terms of diarrhea, in terms of other immune problems which happen. So therefore, breastfeeding, which is natural, which is the most important food, like I mentioned again and again, is therefore the doctors are being advised that are advising the mothers that, you know, maintaining proper hygiene, you should breastfeed your child at least to give that initial food to the child to build up the immune system.
That's a very interesting point to make. Dr. Devor, UNICEF, with all its partners on the ground and already involved, I'm sure that you have a very sort of a correct picture of how this not just the 1,000-day program, but nutrition per se is being sort of dealt out, in all the different states of the country. So particularly when we come to this 1,000-day program, there's a lot of disparity amongst various states. Now, do you think that's only attributable to sort of economic reasons, or are there sort of, other infrastructural reasons, or what would you attribute that to? Why is there no uniformity in the way this program is being implemented? Or I mean, would you agree that there is a problem in uniformity, or do you think that that's just a...
Well, there's definitely no uniformity if you look at how the levels of malnutrition in different parts of the country. But even within states, you see large variations of levels of malnutrition as well. Even within districts, you see many differences. Globally, we know, and for me, India is actually a very good example. We know that the number one factor is not just money; it is about leadership. Yeah, and I think that particularly under Poshan Abhiyan, I think we were all very encouraged with the level of leadership that we saw at all the levels. But at the same time, we also know that leadership is not enough. When I came to India, I was very, very impressed with the broad set of high quality programs and schemes. There are very few countries in the world that have a multi-sectoral comprehensive program to address malnutrition like in India. You have social protection interventions, you provide food and feeding to many different groups, vulnerable groups, from pregnant women to children to the poorest. You have a lot of services from the health sector, from Ministry of WCD. So I would say, actually, on paper, technically and programmatically, the programs are very, very sound. Yeah, and that is, for me, that's very encouraging. But the problem is, it's the implementation. I call that there's a problem in what I call C-square IQ. And let me explain what that is. First of all, on paper, you might have the right programs, but you need full coverage. That's the first C. If you don't reach all that needed, then we don't have the impact. Then you might have a high impact intervention, but that high impact intervention doesn't have the impact because you don't reach all. And I think there's a challenge, and we see in different parts of the country that coverage of take-home ration, coverage of vitamin A supplementation, coverage of iron folate, which is used for reduction of anemia, significantly changes, or is significantly different between different parts of the country, but also within different states. Yeah, so you need the coverage, and the coverage you need to get to 80–90% coverage, because otherwise you're not going to get the impact. Then you need continuity of services. And for me, an example is always, I love breastfeeding week in September, August, September globally. August, we have breastfeeding week. But to be honest, I think we need 52 breastfeeding weeks. September is Poshan month. Well, and a lot of education is done to educate people about good nutrition in September. But if it's up to me, I would say we need continuity. We need 12 Poshan months to support understanding and awareness around nutrition. That's not something you change by one message. You need to continue that. And that is something that we saw during the COVID crisis. There was a gap in the continuity of services. So there was the second C, the C squared IQ. Then you need intensity of services. You know, I remember I once went on a road trip to Madhya Pradesh. I drove 2,600 kilometers. I saw hundreds of adverts for Coca-Colas, for Pepsi, for Maggi noodles, for many products that we don't consider that healthy or nutritious. I saw one advert, one corner, a building, which turned out to be a breastfeeding corner where women could come to breastfeeding their child. One message in public space. So we need to have the intensity of the messaging and of the services to have the impact. And that is what is lacking. And there you see a big difference in different parts of the country. And last, but definitely not least, even when you've got coverage and you've got continuity of services, and even when you've got intensity of services, you need quality of services. Yeah, and sometimes maybe some of the food that is provided through some of the schemes is not necessarily always the most nutritious food. For the youngest children, 6 months to 12 months, which is a critical time. And the data shows that feeding practice of those children are so poor. That is where malnutrition in India starts during pregnancy. After that, things are not too bad, but then from 6 months to 9 months to 12 months on, it is very bad. Less than 10% of the children receiving the type of food and the quantity of food that they require. So we have to improve also the quality of food through the feeding schemes. We have to improve the quality of counseling services, support services. So I would say what I call C-squared IQ: coverage, continuity, intensity, and quality of your existing packages. We don't need much more innovation. On paper, India has a brilliant program. There are not many countries that have got such a comprehensive, well thought through program, but the program needs to be delivered with C-squared IQ. And if you start analyzing it, the states, the districts that do focus on the C-squared IQ, on all these components, have a much higher impact of their interventions, and therefore also lower malnutrition rates. Thank you very much.
Yes, thank you, Arjan. You know, Mr. Dasa, I have a question for you. You know, you like I mentioned earlier, you have one of the largest sort of feeding programs, but it's mostly meant for school children. Given the pandemic that we face now, and given that most children are now, you know, not really going back to school for some time, do you have any plans to sort of expand your, you know, the scope of your feeding program?
Yes, this has been one of the important things that's going on in our minds, because we have our kitchens with large capacity and all of them are idling. We are feeding as per the different opportunities and requirements that have emerged. We were involved in feeding the immigrant workers and people and labor force locked up in different circumstances. So we have been doing all of these kind of feeding programs, not necessarily the children program. Children, most governments made the policy that we should distribute dry ration through the schools, and we have been doing that. And you know, all of this discussion is about the 1,000 days of critical days of a child and the mother. I must mention that, you know, apart from the midday meal program, we have also been feeding about 140,000 children in Anganwadi centers. During the last 2.5 months, quite a few Anganwadi centers have become dysfunctional. It's just that the children are not coming there. The mothers are not coming there. So quite a few are dysfunctional right now. And so it is a very alarming. I'm hearing from all the experts that how important and significant this is. Just now, yes, we have wonderful programs. The challenge is in the implementation of the program, the continuity that we just heard about. So this is actually the challenge. And of course, in some governments have realized that. In Gujarat recently, we were asked to make some kind of a long shelf, a sweet preparation which has a long shelf life, so that they can reach it to the children from the Anganwadi centers, and their mothers and children can take it home. So some attempts have been made, but it is a lot more needs to be done. So we have been thinking that yes, whatever other kinds of opportunity feeding programs that are available that come about, we are ready to be involved in. We have been reading that how middle class families are going to run out of all their savings at the end of month of June. So if middle class families are going to have this problem, what to speak of the even more vulnerable sections in our country? So it's a very, very important, serious matter. And so we are very much contemplating working with the governments or with other organizations, business corporations who can support. So how to make a most inexpensive but nutritious meal and reach it to the people. So we have been working on these kind of ideas and piloting different ideas. Like in Bangalore, we have just started trying out going to the slum areas where there is a need of these kind of a thing, and make one meal available every day for children, women, elderly people, and whoever is in need of. So we have been contemplating, and we have been piloting in different parts of the country. And if we get the necessary support, we want to scale up, and we have the capacity to scale up.
Well, thank you so much, Mr. Dasa. We are almost running out of time, so I'll try and close this with Dr. Ranjan. That Dr. Ranjan, some doctors and civic workers are actually arguing that given the pandemic and the tremendous pressure it has put on the healthcare system and other systems in place, that the 1,000-day program is perhaps can be put on the back burner for a while. How would you react to that kind of an assessment?
I think this is a very pertinent question the coming today's and the coming days. And if I see like in our country, like zero hunger, and we know that zero hunger and good nutrition have the power to transform the present and future generation. Malnutrition in our country remains threat to the survival, growth, and the development of the children. And child malnutrition happens very early in life. Their nutritional status deteriorates rapidly over the first 2 years, and once this damage is done, catch up and recovery are almost impossible. So like what coalition, this is one of the important objective of coalition, like how to improving the quality of food, the feeding practices with the help of all our members, and with the help of the better good programming, and the nutrition situation in India in the first 2 years. That's the first 1,000 days. It's a represent, as Dr. Shweta has rightly mentioned, and Dr. Arjan, like represent a critical window of opportunity to break the intergenerational cycle of malnutrition. In this critical opportunity, if we are going to miss this critical opportunity, we'll continue to self-perpetuate. Like the malnourished girl will become malnourished woman, who will birth a low birth weight infants, who will suffer the poor malnutrition. So this is the best opportunity, and this is the best opportunity to break this vicious intergenerational cycle in the very concrete, very concrete efforts, and how to collaborate. The multi-sector planning is very important. Efforts in improving the nutrition of infant and young child from conception through the first 2 years of life. And in the present scenario, like after this COVID, we understand that the possible impact would reduce in the number of meals per day, hence the quality of food per meal as well. I think that has been reduced. Ensuring diet diversity at the time of this COVID is also remains a challenge, as the main goal during this time is the health crisis and the lockdown. Basically, the basic good food. Basic food is the most important thing. Therefore, the quality of diet is also compromised at this juncture. And on behalf of the coalition, I would like to suggest like information technology here can play a very important role, because in this time, how to reach to the mothers, how the proper counseling can be given to the family, to the mothers. So information technology can be leveraged for ensuring many services related to maternal and child, especially to ensure the like proper counseling during the 1,000 days, as machine learning as well as the artificial intelligence. Maternal and child, such as the mobile phone for counseling by the frontline workers, our ASHA worker, Anganwadi workers, even the ANMs, use the remote health advisory intervention. Already in India, we are having the remote advisory health services. We can dial that is the helpline for getting all necessary health and nutrition services, proper counseling. And the Poshan helpline in some of the states during this COVID started the Poshan helpline. Like recently after the cyclone, West Bengal started Poshan helpline under the ensuring healthcare, immunization services, and the regular counseling to the mothers through nutrition specialists. So this is an opportunity how we can take care of the 1,000 days, the mother as well as the baby, infant, and first 2 years. And I would also like to add, like Government of India has already initiated the nutrition garden. How nutrition garden that should be largely promoted to the mothers can participate in income generation activities and hence cater to nutrition to their child and themselves. So the GIS tracking, already Ministry of Rural Development, Government of India has initiated this like GIS tracking to identify hotspots at the block and your sector level can also be done with the required actions. So these are the things I believe can play a very vital role to reach to all the mothers, reach to family, and take good care of themselves, so that we can have a kind of healthy, we can provide a healthy baby and the healthy their childhood and the adulthood. Thank you very much.
Thank you. After listening to all of you, all I can say is that if Outlook and Poshan can help in any way to help you sort of disseminate the kind of things that all of you are doing, please don't hesitate to reach out to us, because it will be an honor to really help all of you if we can, in whatever little way we can. I'd like you all to stay on for a minute after we close, because I have a small request from all of you. Thank you so very much, all of you, for coming and joining us. I know many of you came at extremely short notice, and I'm really hoping that we have for those of you who are not aware, this is a almost like a 3-month campaign. So I'm hoping that some of you will rejoin us when we come to some specific parts of it. Maybe you could, if not rejoin, maybe you could give us some ideas on how we can work on it. Thank you so very much, Dr. Devor, Dr. Khandelwal, Dr. Branca, Dr. Ranjan, Mr. Dasa. I'm truly grateful for all of you taking time out for this. With that, we come to an end of this program of 1,000 days, but I would urge all of you to look out for the next webinar on this. Thank you so much. If you could just for a second up, what we're hoping to do is that, as part of our promotional thing, this is the request. You don't necessarily have to do it. If you could just sort of, state your name and then say, hi, I'll use Dr. Devor as an example. If you could say, hi, I'm Dr. Devor. Watch me talk about 1,000 days in nutrition on Outlook. And we'll use each one of them separately when we run this campaign, so that, it'll help us sort of promote it in some ways. So, if you have a problem with that, I can understand that it would really help us a lot. So, Arjan, would you like to start? Just a quick thing saying, hi, I'm Arjan. I think the mic is off, Arjan.
Yeah, exactly. No, hello. No, thanks to Outlook Portion for having UNICEF being part of this. We as UNICEF, we believe that the first 1,000 days of a child is the start of a lifetime. The first 1,000 days is the start of an individual's life, but the investment is an investment for a nation. And congratulations to Outlook Portion for giving attention to these 1,000 days and the importance of nutrition in those 1,000 days. And I really hope that everybody will join all the activities going to be organized by Outlook Portion around this. Thank you very much.
Thank you, Dr. Khandelwal.
Hi guys, my name is Shweta Khandelwal and I'm very excited and happy to be a part of the Outlook Portion webinar, which is talking on the first 1,000 days. This is a very, very important period and I'm really, truly grateful for this opportunity. Thank you.
Dr. Branca.
Francesco Branca, Director of Nutrition and Food Safety from WHO Geneva. Congratulations, Outlook Portion, for bringing nutrition to the attention of the general population, and particularly focusing on the 1,000 days, really critical time that will shape not only the health, but future performance of what will be the citizens of India. This is a critical time, but we can all together find solutions to address the challenges and build back better.
Thank you, Mr. Dasa.
Hello, everybody. So happy to be part of this Outlook Portion seminar. I am Chanchalapathi Das from Akshaya Patra Foundation. We have been involved in providing midday meals to school children in the country last 20 years. But now we have been involved in providing COVID relief activities. Now it's so important. India is a very, very big country. We have a lot of complex problems and our leaders are dealing with so many things. In the middle of that, this care and concern for the 1,000 days of the mother and the child is so important, and that should not be lost. And somewhere in the cracks, it should not be lost. So it's so important that our Outlook Portion has brought a special spotlight on this important factor for the good of our country and for the good of all of humanity. Thank you.
Dr. Ranjan.
Yeah, namaskar, everyone. This is Dr. Sujeet Ranjan from the Coalition for Food and Nutrition Security. And I'm very happy to be a part of Outlook Portion. The coalition is looking for good governance, good policies for nutrition awareness as well as collaboration. So let's make it together, and I'm very much sure that together we'll make it. Thank you very much.
I appreciate what you just said in the sense that I'm really going to be looking forward to all of you, the good wishes and your support for this program, because it's a 3-month-long thing, and I just cannot do it without your help and support and good wishes. With that, thank you so very much, and a big, big namaste from me to all of you. Thank you so much, all of you. You have a fantastic day.